When you are deployed as a nurse or doctors in a field hospital like that, we are trained very much for the situation. First of all, we have to have the skills in the doctors and nurses who can do that job here. So we recruit them on the basis of their curriculum. They are surgeons and they have experience in what we are going to do out there. Also the nurses have. And we have to train in a simulator. This is a setup in England where we train the whole organization before we deploy it, because it is a very complicated hospital to run out there. But also we look a little bit into other skills that is more military. We should be fit. If you want to join the military, we test if people are fit and we are in a good condition. What I don't have a picture of is what we also train to shoot. Of course, and I'll be honest that of course we also have weapons, and that is also a little bit of paradox. But very lucky, when I look into my file, I couldn't find a picture of that situation. And that's why I must say I have also told the doctors and nurses who want to be under my command that if we want to show what we are doing out there, please don't show you are a soldier, but please show you are a doctor or nurses, and that is the main focus you should have. So lucky enough, I don't have a picture of our training where we train basically what is the front of the gun and what is, and in this wise, is the best and more secure situation for yourselves to be. In our situation, we managed it in that way. We don't have, of course, we have a personal weapon. We don't wear it when we are out there. It was all in a stock. And due to the situation, we could handle the weapons out to the personnel if the situation changed in Camp Bastion. Luckily enough, it didn't. Well, what about our manning in the field hospital? In total, we were 805th in the hospital. And from the Danish side, we deployed roughly 100 persons. And the UK deployed 43 and US 45. So it was what we will call a multinational hospital. We from the Danish side have responsibility or have command during a 3-month period this summer in July to October. You can also see the different departments looks very much like a hospital. We have the headquarters, the leading of the hospital, the command of the hospital. We have an emergency department. We have intensive care units with 10 beds, could go up to 14 beds. We have a theater with 3 operation tables. We have a ward roughly with 30 beds. It could be extended up to 50 or 60 beds. And we have a lab and X-ray department, the X-ray also with a CT scanner. What did we do in Afghanistan? Here you see the numbers of patients admitted to the department. We took over the command of the field hospital here the 20th of July, and we have command until mid-October. The figure is that the blue is the very sad situation. That's a patient admitted to the hospital dead. KIA stands for killed in action. So you have a number of patients who could walk in the hospital or sit in a wheelchair. So you have the T2, that's patients who are on a stretcher but not flattened on life or limbs. And so you have the more severe casualties up here in the red, T1. who are patients where we felt that the life or limbs are threatened. As you can see, we took over the hospital in a rather calm period, but just after we took over, it just went up due to the situation in the battle down there. So in the first 6 or 8 weeks, we were very, very busy with the numbers of patients we were treated at that time. Such a figure is also that it is a strange situation that you as commander could regulate the war down there. You can say the meaning of this conference is to discuss how could we prevent that people suffer from war and conflict. And the easiest answer was for me to say, stop the war. I can't take any more patients. And if I do that, the war will stop out there. Theoretical speaking. But you should remind that you should also be aware of being a commander of a field hospital. You're also part of the game out there. So it have influence. The whole situation of being in a conflict out there is also how the hospital is running. So the commanders out on the field who next day decided whether should I go in an area where there is a risk for casualties, should I go in there, depends on the status of the hospital. And therefore, in that code here, it also is a code that is very much looked on the command structures out in Afghanistan. Who do we treat on that hospital? You can see the most, and that reflects also to how many soldiers there actually are in Helmand province, is that half of them are British. In total, we treated roughly 2,000 patients during the 3 months period. 1/4 is from the United States, a little bit Danish. That's roughly 5%. But this piece of the cake is probably what this audience is interested in very much, and especially the blue one. That's the civilian Afghan. How many are actually treated on the field hospital? I already mentioned how these civilians have access to that field hospital due to how we regulate it. But you can see the numbers are not very high compared to how many soldiers you actually treat on. You should know that it is a rough situation out there, and you should also know that that's also to remind you how unequal the situation is. The situation is very, very unequal. First of all, about the conflict. Many of the conflicts today are unequal. It's not two big armies or two big forces standing against each other. Many of the conflicts are unequal in technology, in resources, and so on. And that's also in base of the medicine going on out there. I still remind you of that this hospital had the capability to give, for instance, massive blood transfusion. And the massive transfusion is more than 10 units of blood in 24 hours. And some of the casualties, are requiring many more. And we also have other kinds of survivors who will probably not survive in other hospitals than a field hospital.